Now let's talk about the complications with which a patient can either present with or can develop with the COVID-19 infection. As we know that the COVID-19 generally targets the respiratory system. So generally, initially the patients present with dry cough and fever and upper respiratory tract symptoms. But and these are the majority of the patients, about 80% of the patients who have a mild self-sustaining disease, and we don't have to do basically anything, just manage the fever and other complications. But in certain population, for example, in about 14 to 15% of patients, they can go into a severe disease, or 5 to 6% of the patients can go into a critical disease. The disease development of the disease is the patient initially starts off presenting with general non-specific symptoms, and then there is development of the pneumonia. With pneumonia, we have a classical signs and symptoms of cough, chest pain, high-grade fever, and most of the patients recover from pneumonia after basically managing the signs and symptoms. But the feared complications of the disease, which basically fall in the 5% of the category which have a severe presentation or a critical disease, these are the ones which we are going to talk about briefly, and these are the ones which we fear the most, because this age group or this patient population has the highest mortality among the patients presenting with COVID-19 infection. In these, the most common or cause of death or the most feared complication is the ARDS, or acute respiratory distress syndrome. We all know ARDS is basically a respiratory infection, or basically a generalized inflammation of the respiratory system involving the lungs. It can be because of the neutrophils, or it can be because of certain other types. A lot of other disease can also lead to the development of ARDS, specifically certain types of sepsis or pancreatic disease in certain patients, in certain pregnant population who have placental problems, placental abruption, or various other types of abnormalities, or certain generalized infection development of the sepsis, as I just talked about. So these patients generally can develop acute respiratory distress syndrome, and the signs and symptoms of this are basically, you can think of as worsening pneumonia symptoms. The patients will have very great difficulty in talking, great difficulty in having a complete breath. Shortness of breath is the major symptom. The patient might have dyspnea. The patient describes that their chest are being flooded, or their lungs are being flooded with water, and they are just having a feeling of the drowning. So that's why they are unable to speak in a proper sentence. And with this development of the disease, most of the patients, they might require certain ventilatory support until their lungs recover on their own. So this is the most feared complication, and basically the most common cause of death in patients presenting with the acute respiratory with COVID-19. Along with that, certain types of cardiac complications have also been found commonly in these patients, specifically certain types of arrhythmias. And if someone is already having a compromised cardiac system, for example, in someone with a heart failure, or someone with a history of myocardial infarction, or uncontrolled hypertension, and they have certain abnormality already with the CVS, then they are also very prone to developing the arrhythmias. The arrhythmias can be supraventricular, they can be various types, it can be bradycardia, and most of it is well taken care of, but the patients can also develop certain types of life-threatening arrhythmias. Along with that, we might have the patients developing shock-like symptoms or acute cardiac injury. There might be certain types of multi-organ dysfunction, and these are the major causes of death, along with the acute respiratory distress syndrome, which are feared. And these complications are not commonly found in someone who has someone who is young, and someone who has a good immunity or a good immune system. But generally, the patient population who is more prone to these complications are either a very old population, for example, someone above 80 or 85-year-old, or someone who has already a lot of comorbids, for example, with uncontrolled diabetes mellitus, or certain types of heart diseases, history like heart failure or myocardial infarction, or someone with the compromised renal system like chronic kidney disease, patients on dialysis, and specifically patients who have already compromised respiratory system, like patients who have a long-standing COPD history, the smokers, someone with asthmatic history and very frequent status asthmaticus episodes. These are the patients that if they develop the COVID-19 infections, we have to be very careful with these patients, and we have to be very vigilant, because this is the patient population who is very prone to developing the complications, and thereof leading there is increased mortality in this age group. So these were the major complications related to the COVID-19 infection.